Of medicine and health, so simple. However, we're doing 4 lectures in the brain this year. This one and the one in November. The next 2 have not been scheduled yet. They'll be next year. When he told me that he had reviewed 5,000 pages of the latest research in the brain, and he condensed it down to 2,000 pages, and then he started figuring out what the titles were going to be for the lectures. So you are really going to have your good basic on the brain. I hope everybody brought something to write with. Dr. Nasser, we're so happy that you're here.
Okay, thank you so much. Thanks. I guess I have to hold this in my hand. How are we going to do that? Can you hear me in the back without a microphone? No. Oh, you want me to tie it right here? Put it right there? I mean, nail it? You think she said nail it? Oh, boy.
Anybody got a hammer?
Right there. I don't want to cut. No, that's fine. Well, can you hear me? Okay, don't look close at them. It's true the topics we decided to speak about this year and next year is all related to the factors that affect the brain and affect the memory and affect the energy and everything related to the nervous system. And if we're going to talk about the brain, we have to understand that the brain controls the body. And God has differentiated us, humans, from animals by giving us one extra part in the brain that animal does not have. That's the brain stem. The animal have one lower level. We have 3 levels, and the upper 2 levels of the brain stem, which make us human, give us the reasoning and the thinking and all of these things, which animals do not have that. So if we lose the function of the brain, you can imagine yourself or your neighbor or your friend, I'm sure you have seen some people yourself, that they have good brain function, all of a sudden they lost it, they're not the same anymore. You notice that, but they don't notice that. Memory loss is a gradual process. Goes slowly, 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 until it becomes noticeable, but the family are the last to notice it because they get grown to it. You and your family and yourself, you still think it's normal. Where other people around you have not seen you, do not think it's normal. They think there's something wrong. So the best person to evaluate a person's memory is the person outside who have not seen that person for 3 months, 4 months, 6 months, or a year or 2 years. They can say, gee, what's happening to that person? When I decided to speak about the brain and nutrition, all my lectures about how nutrition can prevent, how nutrition can cure, and how nutrition can treat. So nutrition has 3 roles in the body. 1 prevention, 1 treatment, and 1 cure. Like treatment, it can be used in conjunction with something else. And cure can be itself is the main cure. Nutrition can be the main cure of a disease. To review this group of lectures coming, the brain lectures which cover the brain function itself, which include the memory and all the parts of the brain and the dizziness and all these things the brochure says. And then to review the other functions the brain controls, like the hormones, we decided that will probably take about 4 lectures. That's 6 hours to do that. The first lecture today is going to be the most basic one, the most important one, to get you to know the brain, get you to know what part of the brain is going wrong in your life, to let you know that what factors have affected the brain, what things can make the brain better, what things can make the brain worse, just to get you acquainted with the brain, and also to give you an idea. The reason I put that picture to start with right here, I'm sure you have read the title of that, all of you, most of you, How the Brain Keeps Itself Fit, Discovery of Healing Chemicals Offers New Hope for Treating Alzheimer's and Other Diseases that Steal the Memory and Reason. Because Alzheimer's is not the only one. Alzheimer's is not a disease. There's a bunch of diseases, everything. When you say, gee, what did I do with my keys? That's the beginning of memory loss right there. So who called it Alzheimer's? It's a person with the name of Alzheimer's. However, you used to call it dementia. You used to call it other names in the past. But actually, memory loss has been with us for a long time. This here it just shows that a nerve cell was dying and a new nerve is being born. And the reason I put it there, before I start giving you the bad news, I will give you the good news first, that the brain, it heals itself. And you can't give up on the brain of anybody. So to give that good news, let's go to the other important news information we can talk about. I have summarized those 5,000 pages you're talking about to 100 pages. And then 2 weeks ago, I summarized to 20. Then I summarized to 10. Then I summarized them again to 10, then to 10, then to 10, then to 10. When I was driving here, I still came out with 10. I could not go below 10. So I said, well, that's it. I'm not going to summarize anymore. Because every word will become important words. I can't take out any more information from what's in front of me here. But the problem is, I'm going to condense that in a way that people are going to understand it in an hour and a half. That is what makes me sweat. Not the heat right here, is to be nervous how the person in front of me is going to understand what I'm saying. Well, to make it simple, we start by saying that the human body is made from a skeleton. It's the skull right there, connected to bone, and this is all going to lead us to the brain eventually. And this skeleton made of bone works under the order of the brain. The brain tells us, this bone in front of us, what to do, which make red blood cell, white blood cell, and defense cell, and all of these things. This human covered with yellow skin, that's the color came in my hand right now, it's yellow. So it's a yellow skin. So this person's skin also controlled by the brain. If it is cold, the skin will react different versus hot. And the same thing with the hair. This person has organs inside him. Digestive system controlled by the brain. If you're nervous, you can have diarrhea. If you're nervous, your stomach can have gas and all of it. So the brain affects the digestive system. That's true or not true? So I'm just trying to connect your brain with your body now. So you can understand when we go inside the brain, how important it is to understand that the rest of the body is connected to that brain. The liver is also under the order of the brain to detoxify the body. The pancreas under the order from the brain to secrete enzymes and hormones. And in the back, right here, the kidneys under the order from the brain to secrete urine and manufacture hormones. And the adrenal gland over it under the order from the brain to secrete many hormones, which we're going to be talking about that in the next lecture. This brain, this body, have other organs like the lungs. The brain keeps the rhythm of the lungs, 18 per minute, 20 per minute, 22 per minute, slows down at night to 14 per minute, goes up in the daytime to 18 per minute, 18 breaths per minute. That's what I'm talking about. And then when you're afraid or scared, the brain will order the lungs to bring more oxygen to the body, so you start hyperventilating, or you go like that, like you notice that's controlled by the brain. And then if the brain has a problem, you might stop breathing at night. We call that sleep apnea, that you're not breathing properly, stop breathing at night, and that's also from the brain. So the other organ in the body is the heart, right here, that pumps blood to the rest of the body. It's also under the control of the brain. When you are sitting in a room like this, and your heart rate right now is about 80 times per minute, or 70 per minute, and then somebody saying we have a fire, either you heard it, that's the nervous system, the ear the hearing goes immediately to the brain stem, or you saw it, the vision goes directly to the occipital lobe. So you saw it in the brain, and you remember it as a fire. Or you smelled it, goes directly from the nose to the frontal lobe, that you remember that's the smell of smoke. What happened here? The brain sends a message to where? To the side of the leg to say run, to the exit. So the brain sends a message first to the heart also to tell the heart pump, and your heart rate will go from 80 to 150 in 2 seconds. So who controls that? The brain does. And when you go out, to slow down, who controls that? The brain does. So all this function exists in one organ right here called the brain. That brain has a characteristic very important. It has a daytime and nighttime. The human brain is a day brain. Means we are diurnal creatures that we wake up at 5 o'clock in the morning and we go to sleep at 5 o'clock at night. Or we start getting awake at 5 and get out of the house at 7. We start getting sleepy at 5. We go to sleep at 7. That is the man who was in the past before he had electricity and TV and radio and computers. That was the nature for thousands of years. So when Adam came to this earth, came with a body like this, God created him as a human, and he did not come from a monkey, because the monkey cannot develop brain stem, higher level of brain stem. There's no animal can have higher level brain stem except the human being. So the people who fool people, scientists, ignorant scientists, Darwinians and other evolutionists who control the world right now, basically they are teaching wrong things to the students that we evolved from monkeys like everything else. But I wish they read neurology, physiology, or biochemistry before they talk. We're not saying I wish they believe in God. I wish they know science. They claim they know science. I wish they know the science they're talking about. Because they don't. This man in front of us here, if this was Adam, Adam was different from us. The difference between him and us is he's the first person, we are not the first. You follow me or no? We came from our parents. And when we are born with no knowledge. The baby when he's born with no knowledge at all. Only involuntary actions. How to suckle, how to sleep, how to go about, how to cry, survival. That's the lower part of the the parietal lobe down here in the side, the memory center is stored right there. And then he grow older, he remembers. He can remember right, he can remember wrong. It depends on what he's been taught. Follow me or not? But Adam was not like that. Adam was born with the knowledge. So there is a difference between us and Adam. That he was born with knowledge. That when God had decided to create, like we have a Muslim in the Quran says that human being was created from Adam. God created one man and one woman. When he decided to create Adam, he was still in the angel, and then he created a human being. Then they answer back, at least this is the discussion I'm reading in the book, how can you create somebody who's going to corrupt in the earth and kill and destroy? How do you know that? Especially angels don't have memories, don't have brains. They use their brainless because God tells them what to do. They close it. Are you following me or not? They cannot create, they cannot cause death, they cannot change anything without the order of the creator. You understand that? Tell one, go make this person die. Go make this person survive. Go prevent this person from taking a trip. Because he might get hurt. God knows what's going to happen to you. If you take that trip, you're going to have an accident. Then he will create a problem for you. Go give him a 2 flat tires. Go do this. Whatever reason. Everything have a reason. But when Adam came in, he was created. They didn't know, of course, that. They knew that his blood and all this problem. But he was not a stupid person. He could not have been stupid. He could not be a baby that he just has to learn. Is it possible or not? Everybody has to grow from a baby. Was Adam a baby? He can't be a baby. Because if he's a baby, he has to learn everything again. But he was born to differentiate between a cobra and an eel or a fish in the ocean when he wants to eat. They look alike. He has to differentiate between a spider, a scorpion, and another, because if he makes one single mistake, we're in trouble. Right or wrong? The whole creation is wrong. So he cannot be perfect. And he is not perfect. So, but he has to have the knowledge to know what to eat, what not to eat, what vitamin is good, what's not good, what drugs are good, what drugs are bad, what herbs are good, what herbs is bad. So you walk in the desert in Africa, seeing cactus and seeing this, and he knows exactly which one. Is he learning from you or he had knowledge from before? You follow me or not? If he's learning from you, it will take millions of years to teach him. And he has to learn by errors. Make a mistake and learn from it. He can't afford to make a mistake. Then we have to say he was born as a human, as a man, as a woman, mature. How did it happen? Not a big deal for God. He can do anything he wants to do. So the human being have day and night, and those are inside the brain. Right now, it's about 7:30. We already passed the 5 o'clock time, and we're giving a lecture at 9. So we should have been given the lecture at 6 o'clock in the morning. So everybody would be awake. So I'm not going to be surprised if I see somebody snoozing and yawning now. You absolutely have the right to go to sleep if you want to. This is your time to go to sleep. So at 5 o'clock in the morning, while you are asleep, the brain starts sending messages to the body to tell the body wake up. And the body itself, to wake up, all the cells of the body need to eat. They start getting more blood, so the blood pressure starts going up, the temperature goes up, the circulation goes up, and you start getting warmer by 6 o'clock, and then if you sleep until 8 o'clock or 9 o'clock, you get hot, and you have to throw the covers off. I'm talking about somebody who's sleeping in a temperature of 80 degrees or 84 degrees, not somebody who's sleeping at a temperature of 50 degrees, or somebody who's sleeping at a temperature of 110 degrees. We're talking about normal temperature. stimulant to stay awake, or radio, or you slide yourself, or you cold air, whatever you do, it doesn't work. You go to sleep, and if you're awake, you're awake to sleep. So the body starts going tired until you get to the right time, 8 o'clock, 9 o'clock, you really have to go to sleep. You wake up again, and the cycle continues the next day. During the time of the sleep, things happen, which we will be talking about in a few minutes, called dreaming time or reorganization time. So to do that, we're going to look at the brain and see what is the brain made of. The brain, it looks like this. And the eye is right here. The brain made of cells, right here. And each cell is specialized in certain functions. And the last in the bottom right here is the brain stem I told you about. And that's the most important part of the brain, right, which between the skull and the spinal cord, right in this area, that if somebody gets hit right here, goes in a coma right away. You know, that is the coma center between the two, separating the two parts of the body. And if we look at these cells right here, each one specialized in doing something. Like any cell of the body, specialized in doing something. How much this brain weighs? About 3 pounds. What does it feel like if you hold it in your hand? A jelly-like substance. Gel-like substance. How many cells for function the brain has? How many cells right here you can see? This is the number of cells the brain has. 10 billion cells. The 10 billion cells are the main cells. Each cell has axon and head and tail. So each cell, it looks like this. The head, the body, the tail, and the tail, and the tail right here, and the body is right here. So each cell has a head, and axon called the body, and a tail in the end right here. That's how the brain cell looks like. The brain cells have a nucleus with a father inside made of DNA. And the DNA is the brain center, what makes the cell think. And to do that, he has next to him, here is the cell again. Like that. The DNA right here sits like this, like a Buddha like that, is the father of the cell. And right here, there is a guy with a piece of paper in his hand, his name, the messenger. The RNA messenger. So whatever the brain cell thinks, it gives it to the messenger in writing, and the message runs down right here in the tail, and the neurotransmitter, the chemicals, comes out of the tail to tell the next cell what to do. You follow me so far? The thing is going where it's not supposed to. Okay. It's very simple how it works. The salt, regular table salt, is what makes you dehydrated and you have photo deficiency or heat stroke, you would know that you need salt. Salt and water. The main neurotransmitter for the brain is salt. Sodium goes out, chloride goes in, chloride goes out, sodium goes in, and one atom in, one atom out, they create action potential, which one atom is bigger than the other, has different molecular weight, then they create electricity like the battery have two electrodes, positive and negative. That's how the message works. Until it gets to the very end right here, calcium is waiting for it. And the calcium will take the message and deliver it to the next cell. So without calcium, the brain cannot think. Without salt, the brain cannot think. Are you following me? So far, it looks pretty simple. But when I give you the total number of cells in the brain and wires inside the brain, will scare you. I can say billion. When we get to the total number, it will scare you. That's why each wire is insulated with what? The myelin sheath. And if the insulation goes away, we have a disease called what? Multiple sclerosis. And if the head goes bad, we have a disease called Alzheimer's or memory loss. And if the tail goes bad, we have a disease called Parkinson's, or the stimulation is too much, comes in and out. No control. This cell surrounded by 10 cells. Each cell has 10 cells to repair the head. So the number of cells that can build the brain goes from 10 million to what? 10 multiplied by 10 is 100. 100 million. Now we reach 100 billion cells inside the brain, because the repair cells also have the same function, the same action. Not only they are repaired, they can come and they eat away a stroke area and build a new area in place of it. And we saw that in the picture we showed right here. That the old one is dying, a new one is building in place of it. That is life electron microscope picture. The person's dead. The picture's alive. You follow me? It's taken because you take a picture of the brain, you must be there. So you cannot biopsy the brain of a live person. So this axon right here is in danger, because if one cell touches the other, we have seizures, right? That's what seizure is. Cells are touching each other. We have no control, then seizures occur in the brain, fires occur in the brain, and we study the electroencephalogram, you see the spikes of grand mal and female seizures. Are you following me on that? You've seen seizures, right? And you've seen the shaking, the tremor from mild to major. And that indicates that our short circuit inside the brain. This axon then, if it gets fixed, the person will develop autoimmune disease or multiple sclerosis. It's protected by 10 cells, 5 on each side right here, called Schwann cells. They are the cells that rebuild the myelin sheath. And they use lecithin and B complex to do that job. And how many of them are 10? So the total number of cells in the brain, we have to multiply 100 by 10, then we come to about 1 trillion cells in the brain function. Then we discovered something else. 5 million cells, or every time you have a migraine headache, you lose million cells, but you got billion cells, you got lots of repair there. So it's true that migraine and other strokes and hypertension and stress and all of that, infection and virus and trauma causes damage, but the repair is more than the damage. This is why the older the person gets, the smarter they get. The older they get, the more they can invent. Einstein was not 75, was an older person. Most of the Nobel Prize were older people. Are you following me on that? So this means the brain, if you keep it working, functioning, it gets better with age. The brain does not get worse. It gets worse with age when you don't use it. You put somebody who is very smart in a nursing home, visit him a year later or 2 years later, the memory is gone. This is why nursing homes is not a good place for people to be. So, these cells right here require certain things to function. What do they require to function? They require, well, let's find that person first, bring him back here. We need him now. For the brain to function, that person must eat or get from outside certain things. What does he have to eat? Protein, and the right protein. Soya protein is the best protein in the market. I put that in the lecture because somebody was asking me about different proteins in the market. Soya protein is still the best protein in the market. Fish protein followed, chicken protein and turkey protein third, beef protein after that, and then other proteins are not as good. But egg protein is very good. Egg protein is excellent. Milk protein also is good. I just want to, especially in Wisconsin, I have to put that also, otherwise. But milk without hormones. Okay, but just keep it in perspective. So protein is important for the brain function. Lack of protein creates problems to the brain. Protein builds neurotransmitters. We don't have time to go through tryptophan, tyrosine, lysine, glycine, aspartame, glutamine. I don't have time to go through all the amino acids, how each one will work. After all these hours I spent reading about the brain, the thousands of hours, hundreds of hours, I must remember something. And I cannot tell you everything I remember because we don't have the time. The next food for the brain is what? Sugar, carbohydrate. The brain consumes 20% of your blood sugar. 20% of all the sugar you eat, the brain burns. Are you following me or are you going to sleep now? 3 pounds, the majority of the 3 pounds are nothing but connectors. So the number of cells, if you weigh the 10 billion cells or 100 billion cells, they are nothing, maybe 1 ounce, consume 20% of the carbohydrate, the sugar you eat every day. And the rest of the body is 80%. So that is very, very active place. So lack of sugar or hypoglycemia will cause a disaster to the brain. And the brain will let you know. Right? Because sugar is low, it will let you know. Otherwise, if you don't listen, and you don't run to your chocolate and your ice cream or your Coke or your something, if you have attack of hypoglycemia and you don't do something right away, then you will have sweating and all this problems. So we cannot tell a person who is sugar addict. You are wrong. It's not. It's treating a problem in the brain. The habit of that person is wrong. If he has corrected it properly a long time ago by eating right and exercising way, so the insulin goes up, down, sugar up and down, and have a yo-yo effect. But we have to protect the brain. We don't care what we're going to eat. You follow me or not? When the brain needs it, it got to come. But we have to be smart how to give it, but we have to give it first. Are you following me or not following me? We cannot tell a person who's hypoglycemic, don't drink this Coke. Put this ice cream down. I want to give you some vitamins. Forget it. By the time you give what vitamin is going to do to him that moment. You follow me or not? What do we do in the hospital? We give D5W, sugar intravenously, when somebody's going in the hypoglycemic coma. I remember when I was in West Suburban Hospital by Rush, one of the hospitals belongs to Rush Medical School in Chicago, that I was making around. I was making around with 3 professors from Rush. Dr. Robert Murphy, who's the head of the Department of Nephrology. Unfortunately, he developed Alzheimer right now, and he doesn't remember who I am. And it's sad, because when I called him to just say hello, his wife told me, I have bad news to tell you, he had Alzheimer. So, I was making out with him, with 3 other doctors. We had by a girl, and the nurse told us this girl went in a coma. She's been in a coma since last night. So they said what happened, and then we talked, and they said, okay, she has kidney failure, she has lupus, the lupus attack, kidney failure, all these factors. But I'm a student, not student, really, I'm an intern. And I remember the facts. Like they say to us, if a girl misses a period, the first thing you think about is what? Pregnancy. So things are basic. You always think about, when you think about something, think about the first basic thing. So they say, if somebody's in a coma, think about hypoglycemia. That's the first thing. And everything comes after that. And you follow me or not? That's in the medical book. So the first thing I thought of is my blood sugar. So when they left, I told the nurse, give me syringe, 50cc range of 50% sugar. What's going to go wrong if I give it intravenously? Nobody's going to see me anyway. That's without an order, by the way. I mean, I'm doing it without an order from my boss, but I have a license also. Semi-license. License, under their supervision, by the way. Limited license. I still think it's fine. So anyway, I shut the sugar, and just before they went 4 rooms down the road, she wake up, and I told her, I want to talk to you on the side. I give her sugar, and she's awake. And they looked at me. They didn't say who told you so. And they probably like to do that. But they said, oh, we missed the basics, simple thing, hypoglycemia. And these are professors. So we all can make mistakes. Sugar is important to the brain. I'm not saying here eat sugar. I'm saying carbohydrate is good for the body. Fatty acids, the brain needs oil. It builds hormones. It builds also myelin sheath. It needs minerals. Trace minerals. Zinc, magnesium, manganese, you name it. Important to the brain function. Neurotransmitters, the enzymes need them. It needs major minerals, calcium, sodium, and chloride, and potassium. It needs vitamins, antioxidants, vitamin E. Very important to the brain function. What does it do? It rebuilds the brain. Beta-carotene is very important. It rebuilds the brain. Vitamin C rebuilds the brain. Remember, I'm saying rebuilds in here. I'm not saying it has function in the brain like the rest of the body does. In the brain, it rebuilds or detoxify or clean the brain. How do I know that? I will give you a page from a paper was published in American Journal of Medicine by Harvard Medical School. And that paper right here, it says, I'm sure you're not going to see that far just to believe what I tell you. They say that the cell has inside it what? DNA and RNA. And exposure to chemicals from outside can damage the nucleus and cause problems, disease. You see right here, all these diseases. This is just an example, summary of disease. Your intermediate aging, arteriosclerosis, causes of cancer, cataract, hypertrophy, damage, inflammatory immune injury, autoimmune disease, and on and on and on, and goes on. Alzheimer's is one of them, and Parkinson, and all of these Parkinson's. And right here, to protect the cell, there is what? You cannot see that. You can see it now. Antioxidant. And if we give the antioxidant, we have discovered that there are number of DNA repair enzymes such exonucleases and endonucleases and glycolases that can remove the lesions from the brain. However, the repair system is not perfect. It excites 99% of the damage. Means the brain can correct 99% of the problem it has. We remove that so you can leave if you can, which I'm sure you can. Okay, we go back to this one. Right here, the cell needs vitamins and minerals of all of this. It needs also from outside water. Because if we can have water and good water, you will be dehydrated, and if you feel like when you're dehydrated, you cannot think clearly. That's correct or not? You even can get dizzy when you have a heat strong. Sun hits you, you can even dizzy, you can even die from it. So we know that water is important. Not alcohol. Like somebody's thirsty, and they tell him drink beer. Since when you're thirsty, drink beer? Who's going to take that except a beer company? And who's going to listen except somebody who's dumb? Doesn't have a brain. Right or wrong? You are thirsty, drink water, not alcohol. And you ask the person who drinks beer when he's thirsty, after he drinks 5, 10 beers, what does he drink in the end? Water. Right? Because he's thirsty. Because for every can of beer he drinks, he urinates 3 cans of urine. So he drinks and runs to the bathroom all the time. That doesn't make sense. But why do people do it? Because the TV says so. Because the TV tells you so. And TV educates our children more than school or us can educate them. Remember that TV is our enemy number 1. It can be our friend number 1, but enemy number 1 also. But who's going? Which child is going to select? If the cartoon itself says drink beer, that he's holding a beer can, or the word says Budweiser, or you see a football game like tonight, and you see all these ads for beer companies. When you're running a playing sports, you have advertising for alcohol. It should be vitamins. It should be juices. It should be things that's good, right? They don't have a brain, so they think that way. And you see this ad a few years ago. This person walking in the desert so thirsty, and the about to fall, and somebody gave him a glass cold water to drink. He said, no, I want a straw beer. You remember the ad? Was on TV? And he drank straw beer. So I took the ad, I replayed it to children in school between the age of 7 to 10. 10 of them, and I played the ad to them, and I said, what would you drink if you're thirsty in the desert? Guess what they all say? Straw beer. Maybe they beer. It's straw beer. We trust each other. If you tell me this vitamin is good, I believe it. If I trust you,
endocarditis. And the chemist said, that's a lie. How can they do that? They can do that. So water is important to the brain. Oxygen is important. Did you know that the brain consumes 25% of the oxygen you breathe every day? 25% of total oxygen you take, the brain takes 25% and the body 75%. That shows you that cell on fire all the time. On fire why? Why do I say on fire? Because the car engine, the way the car engine works, the engine right here, if you give it gas, which fuel, plus oxygen, it gives you what? Energy, tremendous energy, and weight. That's natural chemical action. So the brain, 25% of the oxygen, that's enough to make your body temperature 10,000 degrees in 1 hour. You can go up to 10,000 degrees, from 100 to 10,000 in 1 hour, if you don't have the hypothalamus control, the sweating, and the temperature control. It's a furnace inside the brain. It's a furnace that actually, if you shoot it with radiation, it doesn't affect it. Radiation, atomic bomb, does not affect the brain. Where it destroys the body. As a matter of fact, the best treatment for brain tumor is radiation. Because we know you cannot hurt the brain. Radiation, certain radiation. We're not talking about electromagnetic radiation. We're not talking about microwave radiation. We're not talking about FM radiation, FM station radiation. The frequency of those are harmful to the brain. It interferes. It's close to the frequency of the brain itself. It's lower than the other one. I can't go in details on it, but just believe me that the brain needs lots of oxygen. Also needs hormones, because without hormones, the brain doesn't function well. We know that adrenal hormone makes you, when you have more adrenaline, you can think better. When you have more noradrenaline, you think better. When you have more hormone, estrogen, progesterone, testosterone, you think more clearly. Cortisol, adrenal hormone, cortisol, makes you think clearly. As a matter of fact, when we have some people in coma, sometimes we give them steroid IV. Bullet, just one time, and they wake up. Because the brain responds to stimulation like that. So this is what the brain cell wants. And when we put all this food inside the brain cell, it either produces energy and what? Waste. And the energy travels down and you continue to live and learn and function. However, if the waste gets accumulated inside the cell, we call that plaque or amyloid, beta amyloid. We give it the name, we name it beta amyloid. It's actually toxins or chemicals of the brain that will poison the cell and will poison the axon down below, and those scavenger cells will start eating it and rebuild it back again or put another cell in place on it. You follow me so far or no? When we look at the brain of somebody who has a good brain function, this brain will look like that. When we look at somebody's brain that it has a problem, we will see certain plaques in here, different places like that. We see also something very strange. We see also, if I find that brown color again, maybe it's like this one, we see also that the wires are entangled, like this. Every Alzheimer patient will see this pattern. Every Parkinson patient will see this pattern. Every person who loses memory gradually will see this pattern. And every multiple sclerosis patient will see this pattern. The fibers entangle with each other. The plaques are there. And we see also, the nice thing we see in those people, unfortunately, we see them after they die. We see also the repair cells far away trying to rebuild to the inside in huge, huge numbers surrounding the whole area. So that is the brain we talked about so far. So to go further, and the brain, I'd like to tell you a little bit more about the anatomy of the brain. The brain looks like this. It's made from an area in the front and an area in the middle, an area in the back. This is called the front area. This is called the back area, occipital area. This is called the temporal area on the side right here. And this is called the parietal area, and this is called the main brain. And also, it has radiators right here to cool it down with lots of this. We call that the cerebellum of the brain. And underneath it here would be the mother of the brain, the thalamus gland, that connected to the pituitary gland underneath, which controls the hormones of the body, all the nerves. Then we go down to the function of the brain, the life of the brain. The lower one, the brain still controls breathing, heart rate, and survival. And the upper one right here controls balance and other higher function, intellectual function. This frontal area right here is responsible for learning, reasoning, solving problems, that's the specialty of that area, and managing stress, controlling stress. And just I have to always review my notes so I don't miss one word. And then the occipital area in the back here is very interesting area because it's connected with the eye. Whatever you see a person right here, then you have the picture of the same person right here on the TV screen. So whatever you see, it's in the back there, in black and white. The color only the eye makes it in color, but the brain will see it in black and white only. So when you have to remember something, you have to remember it only in black and white. Then now you remember it, you saw it, then you don't know what you're seeing, if you know that person or not, if you've seen him before or not, then we get back to the memory center right here. The memory center will take a picture of this person and put it right here and give it a name. That is a person, is a boy or a girl, a man or a woman, his name or whatever you remember about him. If you've seen him before, then the temporal center will remember you, will make you remember it. Memory center right here. If you never seen him before, then, or you saw him, you've seen him but you don't remember, because the memory center, it has it but you don't remember. You follow me or no? You see something, or you see somebody but you don't remember, when did you see that person? This lobe right here, in the back, that's the visual lobe. The temporal lobe right here gives all the memory about everything. Everything you learn, it goes inside here. your life is inherited since you were a child, right? Layers like this, in layers. The newest is 1, the oldest 100 blood cells. So the star you saw when you're 1 year old, today is in the top, 100 years ago will be in the bottom. Are you following me or not? And no single memory is lost. Every single thing you've done in your life stored in a cell right here, in the memory center. Every single thing you have done is stored right here. The parietal lobe, you see, I didn't talk about it yet, is the lobe that brings the memory out. This called the recall center. So, the memory is there in the parietal lobe, the temporal lobe. The parietal lobe is the one called Parkinson's disease and Alzheimer's disease, because it cannot recall the information. It cannot recall the information. Are you following me or not? So the problem is in this area right here in the brain, and we can rebuild it back again. And that's the area responsible for Parkinson's, that's the area responsible for Alzheimer's, for dementia, for all the problems in that area right there. A stroke in that area is a very big, very stroke, because it can create memory loss. And then if the stroke goes down to the brain stem, to the breathing center or the heart center, you will die. You go to coma first, then you die after that, because it depends if the brain stem can recover. And usually it does not. It doesn't have the recovery of the rest of the brain. What happens if, and let me tell you a small experiment that one physician has done, Dr. Widener. He was operating on a brain one time, and you know, brain surgery, when it's done, when we remove tumors, we do it when the person's awake, not asleep. Because we must know what we're touching. So the person has to tell the doctor, the brain doesn't have pain. There's no pain at all in the brain. You come through the brain, there is no sensation inside the brain at all. The only sensation when you have the headache is the pressure you have by having high blood pressure from the migraine headache. That is the pressure you feel from high blood pressure. That is because the brain about to explode. That is the meninges or the dura, the meningitis. You know, the meninges, the membrane of the brain covering the brain is very, very sensitive to pain. Very, very pain sensitive underneath the skull here. Very sensitive. If we put a needle on it, immediately you scream. But inside the brain cells there is no sensation. So when the surgery is done, they numb this area and they cut it so they can go inside by local anesthesia, of course, not general anesthesia, and we suck the spinal fluid out from the area, and then you go inside, and then we want to remove a tumor from this area. He was removing tumor in this area, and he doesn't know which tissue is tumor, which tissue is a memory center. You follow me? So what he's doing, he's having an electric probe, and touching, you feel this, you feel that, you feel that, you feel this, you feel this. So every area, the person feels it, and then when he came to the memory center, the person say, I remember that. So what do you remember? Oh, I remember I'm 3 years old, and I'm doing so-and-so. I remember I'm 5 years old, I'm doing so-and-so. I remember this, I remember that. All the history of that person, he's talking about even things he's not supposed to talk about. Everything is coming out. But the person does not remember that. But the electrode was taking the stuff, bypassing the parietal lobe directly, was recalling the information. So we knew right away there are the memory neuron So that is the anatomy of the brain in front of us. I just like to tell you a few things very fast about the brain, because it's faster for me to read it than talk about it, because we have only 20 minutes, 15 minutes, and I want to go through important things about the brain. The brain is a living computer. It can change its circuits to solve a problem anytime. It responds to 1 million problems from outside per second, and record it and respond to it. When you're sitting like 1 million things, it can sense in 1 second. It can respond to 1 million problems inside the body. I talked outside of the body. Inside the body, from inside, also can sense 1 million of them per second. It must protect itself from overload. It must repair itself. It must adapt. In every millisecond, changes its mode. It must, unlike a computer, it must develop feelings of love and hate and wonder, jealousy, compassion, and all of these things what computer can. It must control the whole body. It must compute quadrillions of problems or functions every second and solve them. This is the miracle of the brain. The thalamus gland, we talked about it, the mother gland, also is the gland that creates peacefulness inside the body, love, happiness, serenity, thermostat, hunger, sleep, day and night. These are the things it controls. Besides that, lots of other things, we're just going to talk a little bit about Alzheimer's itself and memory loss. 250,000 people develop Alzheimer's every year in the United States. 250,000. 100,000 people die every year from Alzheimer's and memory loss problems. 80 million people in the United States have memory loss. 10 million people have pre-Alzheimer's of those. 30% of the Alzheimer runs in families. 70% from environment. 4 million people have Alzheimer's, and 10 million gonna have Alzheimer's, so prone to it. It costs $100 billion a year in costs. 50% of nursing homes from memory-related illness. And then a person who has that memory loss would have problems in the early stages such as confusion, all of us will get that, cannot remember, cannot recall center is not working. The speech might get tangled, words can go backward or difficulty in that. Judgment might not be correct sometimes. Delay in answering questions. You have to think before you answer. Denial of memory loss. All memory loss patients, they deny that they have it. And I just read that in the medical book, and Bill White told me about it before the lecture. He said most of people, he knew about that. I don't know how he knew about that. But he is right. They denial of memory loss, they all of them share that. When it gets advanced, the person who has it doesn't know where he lives, the place, and doesn't know where he was taken, does not remember the previous sentence he just talked about, does not remember family members, does not remember his age and name, sometimes has poor hygiene, doesn't clean himself well, cannot complete a task, misplacing things, mistrusting people, irritability, withdrawal. One of the major causes are accidents because they want to turn left, they turn right. inappropriate silliness that when it's nice to say a joke, but when you have a fire in the house, you don't joke about it. You respond according to action. Suspicious, curious, purchase unnecessary things, doesn't have poor handling of the money, short attention, cannot follow orders, change in their sexual behavior. Some of them will expose themselves sexually, doesn't know what they're doing, because the primitive function of the brain takes over sometimes. Cannot find complete sentence or use filler words. It has no relation to the sentence. And sometimes the gait is get shuffled, and that also affects. The causes of it: stroke, Parkinson, depression, poor circulation, hormone imbalance, malnutrition, and infection from viruses, high blood pressure, drugs, all of these things. We have to very fast to cover something. We already covered the nutrition of the brain. One of the main things we have found in the brain cause most of the problem is circulation. Blockage of the circulation from triglyceride or cholesterol or migraine as problems. They have blockage of circulation too. And the solution to that, we have to clean the circulation by the proper medication. Even we could use acuity or ginkgo to dilate the blood vessels of the brain and give more circulation. We can do that. However, if somebody has a fat buildup, we might use intravenous fluid to clean the arteries, or with EDTA. That is the chelation therapy. We might use vasodilators to allow more circulation to go to the brain also. This is probably the number one problem right here. Because it doesn't matter how good nutrition you have, if you don't have good circulation to the brain, you're going to have problems. This is why we always check the circulation to the brain when we check patients. The thing is about it, the brain also causes the problems right here, is blood pressure. The blood pressure is up and breaks right here, bursts right here, just little strokes, then also affect the brain. Blood clots. You could develop blood clots in the heart, or the legs, or blood goes to the brain and block parts of the brain. This is important to know. This is some of the common causes memory loss in the brain. Another thing causes memory loss is the amount of chemicals we have seen in the United States since 1900 until 1999. Air pollution, water pollution, and food pollution on the rise. And we are just going to list you few of the chemicals that we consume every day. We use emulsifiers in our cooking. That's the same substance we use in antifreeze. We use vanilla flavoring. That's the same stuff that we use the drugs to kill lice. We use artificial cherry flavor. That's the same substance we use in aluminum plastic dyes. We use the pineapple flavor. That's the same substance we use for rubber cement and shoe cleaners. The nut flavor also flavor for rubber cement and shoe cleaners. Banana flavor, that's the same substance in oil paint solvent. The BHA for a cheese flavor, that's the same thing in dyes. The NutraSweet for sugar flavor, that causes methyl alcohol in the brain and causes phenylalanine, and you know how important, how much damage. MSG, that causes in Chinese food, that's a neurotoxin. We have also things like thick building syndrome. When you live in work in a building that has no ventilation, you have a variety infanticide, herbicide. 55% of the water in the state of Florida has high mercury. Do you believe that? Firing has mercury, thermometers have mercury, incinerators of burning human beings put mercury in the air. So very bad. Mildew has chemicals that you get rid of the mildew in the basement have also mercury. Lead, it's in the society, in gasoline, glazed ceramics, imported cans, because it's against the law in the United States, but other countries not. Paint, hair dyes, eyeliners, lead foil, imported beer, any beer is bad anyway, paper mills, wine, sodium fluoride, toothpaste is bad for the brain. Calcium fluoride, natural, is good for the brain. You see that in mouthwash. Arsenic also affects the brain. It's in air pollution, barbecue, wood preservatives. Well water sometimes have lots of arsenic. Aluminum from hot springs, chicken feed, onion flavor, garlic flavor, it has aluminum in it. Shellfish sometimes has that. Bottled water in the market has lots of lead in it, aluminum in it. The bottled water. So you better use the Shaklee Best water, it's safer for you. The viruses can affect the brain, and I selected the chronic fatigue viruses that we find, and most recently the mad cow disease that you heard about in England. That's also from a virus that we have it in the United States also. So I'm going to finish the lecture. Let me see if I forgot anything first. I'm sure I did, but that's all I'm going to talk about. I will just summarize the lecture right now. We have 3 minutes, and then we'll take some questions, because we have to keep the lecture almost an hour and a half, so everybody knows exactly what time we start, what time we finish. Then you can arrange your life around this lecture. If you're going to watch football game, then you have to take time off for an hour and a half and go to the football game. 4 things you have to do to improve the memory loss, the multiple sclerosis, brain problems. 1, you must have the proper diagnosis. Is it high blood pressure? Is it toxicity? Is it MS? Whatever the diagnosis, we must have a diagnosis. Nutrition, we must have the proper protein, carbohydrates, fat, vitamins, water, minerals, and oxygen. We talked about that. And hormones. Then stress can affect the brain. The brain likes stress. It does like the challenge. It likes the stress. It likes to solve problems. It likes to argue. It likes to challenge. But in the meantime, the same brain likes to have a good night's sleep at night, so to recover from the stress of the daytime. So when you have lots of stress in the daytime and you sleep at night, you will have dreams. All the dream means the brain is reorganizing all the information, taking all the information from the frontal lobe, the learning, everything you learned, everything you solved, everything you did right here, and store it. And everything you saw, everything stored down here. So what happens? You close your eyes, you go to sleep, you are dead, half dead. You're only breathing by the God help control over you. You cannot control yourself. When you sleep, you have no control black and white. But you have all scrambled sections. You go from one dream to another dream, and then when the dream, when the body, the brain feels, you think in your head, you don't have circulation, then you have nightmares, then you wake, scream. Or you have low blood sugar, you wake up sweating. Or the blood pressure is too high, you wake up. For survival reason, the nightmares come. The bad ones come when there is a problem in the body itself. Are you following me or not? The nightmares of all the bad news because there's a problem inside the body, indigestion, problem with circulation, problem with breathing, problem with oxygen, problem with sugar, problem with survival. Otherwise, dreams is reorganization of the brain. It has nothing to do with the future. It has nothing to do with the past. And don't say that I dreamed that I know where they killed that person, where they buried him. If you tell the police that, your memory center is telling us that you know and you saw it. You're the one who saw it, you're the one who did it. So if you say, I know where the person is buried, I think you know it because you've been there, you saw it when you were awake. And that's why you think you remember it in the dream. You follow me or not? And every case, they said that somebody leads them to a place, they find out that person has something to do with the murder itself. Or the theft or whatever that. Dream does not tell the future, because our God does not let our dream control our future. Future is designed different from just dreaming about it. Neither dreaming the past tell us about future also. And neither all these people on TV, you dial this number, this number, and tell you, oh, your husband right now is sitting with his piano with some girl that's lazy. All this garbage. These people, when you dial the number, they have all information about you from FBI right there. And they charge you $10, $15 because you dial the number. They know, this number. When you dial a number, they know everything about you from computer centers. So this is how the brain works. And I'm going to tell you my last thing right here is, if I did not cover anything, you can give me a call at 847-356-9009. That's if you want to make an appointment or if you want to call for a question or anything like that. Because this number will be on the page, then we can talk a little bit more about the rest of this plan right here. So, sleep is number one. You must have good night's sleep for the brain to do good job. It's not a coma, good sleep. Number two, you must exercise. Number three, you must control your stress in the house. You must have happy environment around you, not depressing people around you. If you're around people that all they talk about problems, no, otherwise you said problems. Well, I didn't say that. You said that. Okay. I do like it. I do. But, when somebody's talking to me about their problem, yak about their problem, I said, there's nothing I can do to solve your problem. God can solve it if you complain to Him. But if you need my medical advice and you need to borrow $5, I give it to you. So don't tell me about any problem. But this is what happens. People think if they tell other person about their problem, they got rid of their problem. No. Like the two people have the same problem rather than one. And he says, oh, now I talked about it, I have relief. Yeah, you do have relief temporarily, but the other person does not have a relief. So, this is how positive thing. When you have a problem, let's solve it. Let's solve the problem. Logically solve the problem. If it is environmental, if it's social, if it's medical, if it's financial, whatever it is, let's solve it. And let us know that God solves all the problems. And whatever problem He can solve it. Except if you want to borrow $1 million, He's not going to give you that. But He solves other problems. But anyway, this is the problem of stress. We need to be positive. You need to spend the time watching comedies, watching things that you can laugh, you can have a good time. Because during the laughter, the brain loves it. adrenaline pumps up, you feel good, interferon goes up, cancer goes down, the body is still rejuvenated during having a good time. Having a good time can be laughing, visiting somebody, vacationing. When you vacation, don't vacation with somebody you hate. And somebody's going to give you problems. Don't take all the kids with you. Because they are the ones with the problem at home. So, have a babysitter for them. Go alone a little bit. I'm not saying all the time. I think sometimes you need time by yourself. You need time by yourself with a friend or something to, not a closet. Sometimes you feel like going to the closet by yourself. But that is all the stress management. The detoxification right here, number 4, we have to remove the chemicals from the body. Antioxidants are number 1. Number 2, chelation therapy, EDTA, that can be done to remove aluminum, mercury, lead, arsenic, plus other things from the body. And when we make a diagnosis for brain problem, remember, we often find body problems. We'll sometimes find cholesterol, circulation, high blood pressure, thyroid, fatigue, fibromyalgia, autoimmune, you name it. So we solve all these problems to help the brain. Sometimes you have to start with that to help the other part. I will check one last thing right here on my notes, and then I'll let you have some questions, and we answer some of them if I can. Okay, that's it. The next lecture, we're going to be talking about what? The hormones, right? It's about hormones. We're going to talk about the pituitary gland, how it works in the brain, how you get smarter, and how to function better in the brain. That's what's going to be about the hormones of the brain. We will cover some of the female hormones and male hormones in it, but those also will be covered in more detail also in April and May, male and female hormones, adrenal gland also. So we have covered libido loss, dizziness, imbalance, which that is the cerebellum part of imbalance, the back right here, multiple sclerosis, Parkinson, and tremors. And if somebody has a question, I will take some questions, start from the front to the back. Yes.
Generally speaking, what can a person do, like a Parkinson's disease?
The question, what a person do, generally speaking, that has Parkinson's disease. First of all, you've got to remember Parkinson is a problem of the lobe of the brain I talked about, that's also responsible for the other diseases, which is the temporal lobe and the parietal lobe. But most of the Parkinson we have seen in the brain is stem itself. All the fibers coming on back and forth, they little bit entangled. What should we do? We should control the tremors. If we have to with medication, we should. Number 2, we should give them better nutrition, all the nutrition I talked about. Number 3, they might improve with ginkgo, acuity, more circulation to the brain. Exercise might help. Better night's sleep and all of that, and detoxification, like I mentioned. Same thing with Alzheimer's, same thing with multiple sclerosis. Except with multiple sclerosis, we use lots of adrenal-stimulating hormones with them, and they respond to it better, where Alzheimer's patients do not respond to it as well. Other questions?
Well, I was going to ask in regards to tremors, but it's not in regards to Parkinson's.
There are tremors are not related to Parkinson's. It's not essential tremors, and basically, there are problems in the brain. And maybe they overstressed body that we should improve it with nutrition like calcium and B-complex, and that thing that slows down tremors. Yes, sir.
In dementia, is agitation a development of dementia, or is agitation a part of the genetics of the individual.
No, agitation is a result. Agitation is not genetics. Agitation means being upset. That's what you're talking about. Intolerance to stress. That's what you mean by agitation? What do you mean by agitation?
Physical reaction and so forth.
Improper reaction to stimulus. That's maybe what you try to say. Overreaction to things.
They just get agitated on why they are in the institution.
Oh, okay. That impatience, like they don't. Okay. This is part of the disease. The frontal lobe lesion that controls your stress. That if I call you a name or you call me a name, I don't draw a gun and shoot you. You don't draw a gun and shoot me. We should have reason to discuss things, talk about it in manners that it is acceptable to both of us. In a person who is impatient, because the brain is intolerable to things, they overact everything. If the voice is loud, it's too loud, if you repeat the question twice, if you do anything, they're always agitated. That's part of the disease. Dementia is part of like Alzheimer's. It is basically reaction against you and the society and everybody to tell you help me. That's basically all it is. It doesn't mean to hurt you, it just means I need help in a different way. That's what they mean. They don't mean any of this what they say if they swear, and they lots of them swear with bad words. They don't mean any of that. This is the way, the shortest sentence that give him answers will do. And that's the problem with those patients with the family. The family cannot tolerate that a lot. Because stress is the family. And Alzheimer's is very stressful on the family. And dementia is very stressful on the family. And this is why we want to prevent it from happening. It's coming to you, it's coming to me. Because the statistics showing is going up. How do I know by next year I will not be attacked by a virus because my immune system is so weak from all the chemicals I'm exposed to and the stress and everything that all I need is just a little stroke or little virus or little high blood pressure, and by next year I'm done. My brain like Reagan. 1 year he's the president, a couple years later he cannot remember. Yeah. We cannot take our health for granted. When you have your brain right now, that you can see, you can think, we can talk, it's a gift from God to you and me. And we should protect it. Money will not bring it back. But when you have your brain, when you have your health, you got everything. When you don't have it, you got nothing. Yes.
I know of a little boy who's 3 right now. When he was 2 months old, he was given a DPT shot, and he had a 2-hour seizure following that shot. And right now, there's a lot of, I guess, brain cell loss from the seizure, and so now he's like an infant.
The question is, the child will receive injection of DPT vaccination and developed a seizure, lasted a long time, and now he has brain damage. Severe brain damage. Well, this is why when people ask me, I want to have flu vaccine, I want to have this, I say, I'm not going to give you anything. You know? I'm not going to give you anything that I cannot guarantee the result. And the problem is, vaccine is very dangerous sometimes. It is important to have polio vaccine and DPT, but the problem with that child was not the DPT. The problem with that child was the seizure, was not handled right. In a seizure situation, the doctor who gives the DPT, that gives the shot and go, they should give it and have the person under supervision for 2 hours after the vaccination to see if they have seizure or not. That's one way. Another way is a nice way, which I have done it for years. I've been practiced for over 20 years. I've done that. We have done injection many times with dangerous drugs to patients. Like if I want to know if your kidney have a cancer or not, I cannot tell unless I do IVP, X-ray of the kidney. That dye is very bad to the body. It can cause severe reaction, even death. But we have to do it to save a life. So what's the solution here? The solution is very simple. We give little bit of dexamethasone injection with everything we inject. If I want to give you penicillin, because you have meningitis, if somebody has meningitis, is going to die. We have to give them something to save their life, right? That is penicillin. But penicillin also can cause allergy. So how can we guarantee that? Very simple. We should give a little bit of Benadryl or dexamethasone with the penicillin. This way we will have no reaction. Are you following me or not?
Yes.
This is what should be done. We're not doing it. I've been doing it for every single patient I give a shot to all my life. I never give even vitamin shots with a little bit of adrenal hormone with it. I never had a reaction in my life to anything. Even patients who have allergies to penicillin, I have allergies to penicillin, it doesn't matter. We're going to give you that medication right now, and we're going to give Benadryl or something with it, you're not going to have a reaction. And you cannot have a reaction when you have Benadryl ahead of the shot. So simple things like that should be taken care of. That anything you inject, it can cause a reaction. The reaction can cause a child like that to have a seizure, and he lost his brain. Any other questions?
Well,
Yes. Yes, ma'am.
I notice people are using a lot more coffee and chocolate and cappuccinos and things like that. Does that have a detrimental effect on the brain than caffeine?
The people who drink caffeine and cappuccino and all of that, the people who drink that because demand. Either they have migraine headaches, and caffeine and chocolate, they do have anti-migraine effect. It's a natural drug. Caffeine works against migraine. That's why we have a medication called caffeine got. It is a caffeine tablet. So if they have an addiction to that, as a physician, we should not look at what they're eating only. We should also know the reason why are they taking it. Because if somebody come and tell me, I love to have my coffee, I have to think, why do you have to have coffee? Or I must smoke a cigarette, or I must have cocaine, or I must have alcohol, I must have this, if they say that, there must be a problem causing that. Then I have to deal with the root of the problem, then to solve the main problem. We cannot just tell somebody, don't take cocaine. We have to know why he's taking it, why they haven't started coffee. So we don't tell anybody to stop anything without solving the original problem first. By education, then we tell them, why don't you cut down on the coffee, why don't you cut down on the chocolate, why don't you cut down a little bit, and then we can take care of the hypoglycemia with exercise and this and that. And usually they lose the taste and addiction to it. Yes, ma'am.
what recommendation would you have for a person who's in the latter stages of Parkinson's, who's starting to hallucinate, is on medication, and has been told not to take certain B vitamins? Would you recommend a certain series of vitamins or detoxification?
Absolutely, because the person who's telling somebody you must take these drugs and you must live like a zombie and don't take B-complex, the person who's saying that to him, he needs B-complex himself. It doesn't make any sense because B-complex in whole wheat, in wheat germ, in regular food, how are you going to prevent it? You follow me or not?
Well, they said it interferes with some of the medication.
It does not. It's a little bit of folic acid. So what? We can give the medication one time and give the vitamin another time. They're both going to be absorbed in half an hour anyway. You follow me? Yeah. The word vitamin, vita means life. I mean essential to life. How can I tell you don't drink water, don't breathe air, and because you might die if you breathe oxygen?
Is there a program that you would recommend? A certain program that you would recommend to this individual?
We have a sheet. If you call on this number right here, we can discuss it. I can discuss it with you what the recommendations are over the phone.
Thank you.
Any other questions? Yes.
What is your recommendation for insomnia? Sleep is so important for the brain.
Find out the reason of it. That's my recommendation. You can take valerian, you can take all of that, but it could be hormonal, it can be environmental, it can be the air you breathe, it can be the body itself have a problem, cannot let you go to sleep because you need to solve the problem. So the problem with insomnia is the body itself have a problem because the brain wants to sleep. The brain itself wants to sleep. At 6 o'clock at night, the brain is tired. Cannot think clearly. He just wants to go to sleep. So if the body cannot sleep and the brain is want to sleep, then there is something imbalance we have to take care of. I thank you all very much, and I see you next month, and there is some announcements right here Bill is going to make. And if you have any questions, give me a call on this number, and thank you again.
I hope those of you who are here for the first time appreciate what you heard tonight. I know I did. I learned a lot tonight. The next lecture, as I said earlier, is going to be Monday, November 15th. How the brain works with nutrition and natural hormones to reverse. Are you ready for this? PMS, mood swings, menopause, hot flashes. We guys don't have to worry about that, do we? Diminished sex drive, male impotence, osteoporosis, and insomnia. So many of those hit home when I be here 7 o'clock Monday night, November 15th. Thank you again for coming, and if you want to order videos or cassettes, you can order them.
All right, now are you going to come Saturday morning? Yeah, did you get my message? Saturday morning,